Today's dissemination meeting will present the findings of a small study conducted with BALM and Krea. Thank you so much, everybody, for joining. And without much ado, I'm going to introduce our first speaker who's going to open the session, Dr. Lakshmi Vijayakumar. So we're really grateful to have you, Dr. Lakshmi, and it's a very important sort of a milestone and a hallmark for Chennai to have Sneha, which is an NGO which has been working in the prevention of suicide for many, many years. And she's also the head of Voluntary Health Services, Chennai. And she's a member of the WHO's International Network for Suicide Research and Prevention. What is very important for us is that she's also worked on the decriminalization of suicide, setting media guidelines for reporting suicide, and also played a major role for developing a national suicide prevention strategy in 2022. Of course, she's published numerous papers in many journals and so on, and she's interested in developing cost-effective community intervention to prevent suicide. So we're really grateful to have Dr. Lakshmi Vijayakumar to open the session. And many of you can also see the trigger warning, which is being displayed. So please make a note of that. I also want to welcome, we have Ms. Vijaya, who will be signing for some of the participants. And Vijaya has been, we have some of them from Visesh who are joining the session. And she teaches doctors, lawyers, and police to sign. So I'll introduce the other panelists as we get along. But just to set a note quickly, why did we choose this topic? This was part of a Center for Trauma Studies and Innovation, which was part of BALM. And we said as one of the small projects, let's look at understanding risk factors among a very understudied group of adolescents. So this was conducted in collaboration with Krea, and Dr. Sharon is here. So we did this. We looked at, it was a meta-analysis looking at newspapers and recent articles of the adolescent age group. And so we said, let's disseminate this and just look at a way forward and also listen to our experts from the various sectors to share their views on how we can take this up in a very real way across many organizations that are represented. So over to you, Dr. Lakshmi. Thank you so much.
Thank you, Dr. Lakshmi. It's really a pleasure and privilege to be here. If you look at suicide as such, I think we in India have the dubious distinction of having the largest number of suicides in the world. In this, we have even overtaken China, which contributed maximum number of suicide about 10 years ago. But now we have the maximum number of suicides occur in India. And unfortunately, about 35 to 38% of suicides in India are by people below the age of 30. So it is not only a loss to the family, but to the economy, the society, and the country. And what is even more unacceptable is the fact that between the age of 18 and 29, the women have the highest suicide rate, young girls and young women have the highest suicide rate in India. So it's not the elderly or anybody, but young women, who have the highest suicide rate in India. So in all ways, we are paying a huge price because many of our young people choose to die by suicide. And why do young people choose to do by suicide? No, this has been a question which has been in everybody's mind. Actually, if you look at the worldwide data, compared to about 7 years ago, we used to say about 1 million people die by suicide every year. But now in 2019, the WHO has come out with a figure that it is about 800,000. So about 200,000 people less than what was about 5-6 years ago. So what we have found is that the suicide rates have reduced in the elderly, in the middle-aged, okay? Probably with better treatment of depression, the better recognition and treatment of depression. But unfortunately, in many countries, even when there has been a reduction in the overall suicide rate, we find that the young people's suicide rates are rising. And that is a cause for concern, because the proportion of young people, so we call it as the ungraying of suicide. It used to be elderly people who have the highest suicide rate. Now it is the majority of the suicides all over the world are with young people. And it is more so in the US and India, where we see a lot of young people dying by suicide. So when we come to India, why do a young person dies by suicide? Uh, for a young person, particularly we are talking about adolescents. The adolescence itself is a period of change, and it is a period of change physically, emotionally, hormones wise, behaviorally, and everything. And unfortunately, what happens in this phase is that there is a dissonance between their cognitive ability and their emotional control. So that is by the age of 17 or 18, majority of their cognition, that is their capacity to act, their capacity to think, their capacity to reason is become fully functional. But the forebrain, which controls the emotions, which is like a inhibitory center so that we don't act out our emotions, that develops still only at around 25. So the gap between 17 and 25, the adolescent is exposed to a lot of emotions without the functioning of ability to control that emotion. Okay. And that's why many of the suicides happen around this age group. But what is even more worrying, which is really a cause for concern, is that even in India, that there are the number of children below the age of 14 dying by suicide is increasing year on year. Okay, we lose almost 2,500 to 3,000 children below the age of 14 to suicide. So what happens to a child at 14 to think of suicide? Between 10 and 14, we have less than 9, the suicide rates are very, very, very low. But we are seeing an increase between 9 and 14. And see, if you look at what are the risk factors for suicide, or what are the reasons for suicide, there are so many. I think probably one of the IMB module will bring out all the risk factors which are associated with suicide. So I don't want to, because that's another lecture, I don't want to go into that. But the fact is, for long, we have always said that majority of people who die by suicide have a diagnosable mental disorder. Okay. Which is not, it is true probably in developed countries with more than psychological autopsies reveal that more than 80-90% have a diagnosable disorder. But in many low and middle income countries, it is, even according to the global burden of disease, we find it's only 50 to 60%. That is, only 50 to 60% is due to mental disorder, which means another 40-50% is not due to mental disorders. And it becomes even worse when you come to adolescents. Most of them don't have a mental disorder. Only about 30% have a mental health disorder as such. 70% is not. Okay. So what is it that drives these young people to suicide is a question which has been till today not yet answered completely, I would say. Okay, we have various theories, we have various modules, but what is it that makes it is, what shall I say? We don't have a single reason. We don't have a suicidococcus which causes suicide, like staphylococcus or streptococcus. Suicide is multifactorial, and more so in a young person. So there is an urgent need to see what are the factors which are associated with adolescence. And as I said, even research has shown that for a long time, what has divided and dichotomized our thinking about suicide is whether it is an individual vulnerabilities which causes an adolescent to suicide, or whether it is the societal factors which pushes the adolescent to suicide. Now we have concrete evidence to show that individual vulnerability, which can be genetic, biological, family history, whatever it is about 42%. So 58% is probably due to the environmental factors. And we know that majority of the environmental factors can be modifiable factors. Recently, some research have come about, particularly for young adolescents. And these young adolescents, we know, this is a massive study done by WHO in more than 100,000, 150,000 young adolescents. They have studied in 43 different low middle income countries. And what they have found is the longer the child stays hungry, the more suicidal the child becomes. Now, this is something which is really modifiable for us. Okay. The other thing also, which is a very nice study, which is going to be published shortly in Lancet, is the fact that children, it is a prospective study over 10 years. They have studied the children. And what they have found is the fact that children who had healthier diet with more fruits and vegetables, they had the least number of suicidal ideation. Whereas children who were using a more junk food had more depression and suicidal. This is again a modifiable factor. But I would say the biggest modifiable factor is internet use. Okay. We now know that any young girl below the age of 18 who uses more than 2 hours of social media, the suicide rate increases 15% for every hour increase. Well, the social media has really increased a lot of suicide amongst the young girls. For the boys, it is the amount of time they spent in gaming. Okay. And that is a huge factor. We also have enough evidence to show that as the increase in internet usage increases for non-study, non-academic purposes, there is a corroborative concordance with increased suicidal ideation. So so it is possible for us to modify a lot of factors for the young people so that many of our young people choose to live rather than die. I think I've taken more than 7 minutes, but that's what I wanted to start off with.
Thank you so much, Dr. Lakshmi, for a really insightful presentation, which is also most alarming. You talked about gaming, social media, internet, and hungry children and diet. I mean, these are my takeaways from your presentation. I'm going to introduce our, team who was going to present the study. So let me start by introducing Dr. Sharon, who is the executive director of Krea University. And she's part of an action-oriented center with more than 18 years of research and international development. She's passionate about finding effective solutions to help individuals, households, entrepreneurs lead sustainable lives. And she's also an expert in entrepreneurial development. Before this, she worked in Montreal, Canada. She was an economist with an analysis group. She has also done her master's in the London School of Economics and Social Research. So that's Sharon Farah. And then we have Aishwarya Ramesh, who is a research associate as part of BALM. And she's also one of the members of the team. Before this, she worked at Kaveri Hospital, Chennai, as an associate clinical psychologist. She has a background in BTech, computer science, from Shastra University, and she's completed her master's in psychology from Edinburgh. And very interesting that she's also worked with, PCVC International, and she's interested in community-based healthcare, and she's directly involved in training community health workers in the Nalam projects, interested in public mental health, self-harm, and violent behavior. Thank you so much, and over to Aishwarya and Sharon. Thank you.
Thank you so much for that introduction, Lakshmi. I'll just share my screen. This is a very distressing topic that we're talking about, and at any point you feel you want to take a break, please feel free to drop out. Um, Dr. Lakshmi Vijay Kumar has already set the context, has spoken about extensively on what the issue is, what the current status is, and how adolescent suicidal behaviors are something that we need to be prioritizing currently. I'll be talking more about the study and what we have identified through the study. So our primary objective was to get a comprehensive understanding of the risk factors contributing to suicidal behaviors among adolescents. Here we categorize adolescents as young people between the ages 10 to 19 years. For this study, we had wanted to use a model to guide the way we had categorized the risk factors. I want to mention just a few aspects of how models have been and how they have evolved over the years. Initially, I think suicide was looked at as, risk factors for suicide. And over time, I think there was more intricacy involved in what suicidal behaviors can look like, looking at suicidal ideation, suicidal planning, attempt, delineating the different behaviors. We went beyond looking at behaviors from a cross-sectional point of view to a more connected view as sort of like a pathway leading to suicide, and what are the factors that contribute at different stages to different behaviors. So the IMV model here created by O'Connor talks about three phases. We have the pre-motivational phase, which talks about the circumstances around which suicidality occurs. And we have the motivational phase, where which talks about factors that lead to the suicidal ideation being formed. And then we have volitional phase, which talks about factors that convert the suicidal ideation to action. I'm not going to go into further regarding this, but you can have a look at the factors that are being presented. For this study, we had mainly looked at two data sources. We looked at newspaper articles and journal articles during the period 2008 to 2022. And after elimination using inclusion-exclusion criteria, we had arrived at 17 articles and 150 newspaper reports. I'll have to mention the limitations of our study. We did look at only English newspapers, and we do have a small sample size. And for journal articles, we only looked at papers that specifically spoke about results pertaining to adolescents between 10 to 19 years. And we had not explored any other sources of data. Our findings, I'll be talking about findings from newspapers and from journal articles separately. Certain factors you'll see will be highlighted. These factors have been coming up through multiple data sources and more frequently than the others, and which is why it has been highlighted. So we looked at newspaper articles, how they have been presented month-wise. And we see highest number of newspaper articles between the months May to July and between September to November. And May to July is usually the time when school exam results are posted. We tried to categorize how the newspaper spoke about factors, risk factors to suicide based on the IMB model. Just a quick presentation of how it has been presented. Going into the factors, here we have the factors from the pre-motivational phase or the circumstances, circumstantial factors. And then we have factors from the motivational phase and then volitional factors. So in terms of the circumstances, we have low socioeconomic status, people belonging to the farming community. I wanted to point out that interestingly, in newspaper articles, only 21 articles spoke about socioeconomic status, and 20 of them had mentioned low socioeconomic status. And only one other article had said that the person was from a political background belonging to higher socioeconomic class. And then we have a child of single parent as a factor, COVID, which is an environment factor, internet addiction, and then certain life events such as poor performance or anticipation of poor performance, sexual harassment, pertaining. So all newspaper articles that spoke about sexual harassment was about girls who had experienced this. And then being punished by school teachers or principal, being bullied by peers, and then poor outcomes in love affairs. And then we have, in the motivational phase, we have the sense of humiliation and defeat that came up in one of the most commonly mentioned factors in the newspaper articles. And then you have certain emotions surrounding these events. And in terms of volitional factors, we have engaging in games that encourage or support self-harm, such as blue whale had been often mentioned in the newspaper articles. So in journal articles, one of the issues that we had seen in journal articles is that a lot of times they do look at it as discrete events. They don't look at it as, connected events. We're talking about ideation, planning, attempt, and attempt. So what we had done is we had tried to list the risk factors that they found associated with these different behaviors. There's also a category of articles where they just generally looked at suicidal behaviors in general and what are the risk factors associated with suicidal behaviors. So here I'm just going to be talking about the highlighted factors. Again, older adolescents, this talks about people, young children between the ages 16 and 19 years, female gender, having history of any form of abuse. We have sexual, physical, or verbal, being highly impulsive. With mental health issues, they specifically talk about depression and OCD. And then we have substance use issues, engaging in violent behaviors, dropping out of school, and poor performance in school is often being mentioned. And then having poor support system in the form of, we see conflict with peers, poor relationship with parents, not having good relationship with teachers, and so on. Articles that's looked at factors associated with planning was very limited. We had only one article that found that depression was associated with suicidal planning. And then in terms of attempt, we have already gone through similar factors as mentioned in ideation. We also have anxiety disorder being mentioned when it comes to suicidal attempt. And then this group of suicidal behaviors being categorized together, we have these set of factors being mentioned. In this, we also had certain articles which looked at a combination of factors. For example, being a girl who has severe depressive symptoms and is hailing from a higher socioeconomic background, or being a boy and engaging in substance use, or being a boy and having moderate depressive symptoms had been mentioned. Here, we also have certain volitional factors being mentioned. That is exposure to death by suicide, seeing a celebrity die by suicide, or someone from their family or peers dying by suicide, having access to means such as pesticides or ropes can increase the risk for suicide. Now I'd like to invite Sharon to continue the presentation.
Thanks, Ashwar. I'll be brief, I think, because the panelists probably have a lot to say in. Thanks for summarizing the results of a tedious process, but worthwhile. So Ashwar, I'll have to ask you to put the slides. So we actually have like three main insights, and none of them will be like surprising, I guess. So it's just to reiterate a little bit about and I think this was iterated by Aishwarya, also mentioned by the excellent presentation by Lakshmi, that started to her discussion, is identifying precipitation and perpetuating risk factors for adolescent and young adult are complex. And I think the multi-factor process is well known. What we don't know is the ones that aggregate and intensifies individual vulnerability, and then lead to other factors such as isolation, entitlement, emotional dysregulation, etc. And I think while we can talk about these behavior, we don't know the depth of them or how they interact. Often as human beings, we can only understand maybe 2 or 3 dimensions. Other than that, putting several factors, it becomes complex. So I think that's what we felt to understand this transition period between several phases. One thing we also notice is suicide behaviors does not follow a linear process. So I think we all understand that intuitively, but we're not able to articulate. Everyone's situation is very different. And what triggers a person will be highly different from another. It could take a long time or for them to manifest, even attempt of suicide. And some people, it's a very short amount of time. So that also makes it even complex to provide any solutions or any factors to explain it. Next slide. I think one good exercise, and I think the IMB model has not been utilized to understand adolescent suicide. And I think given the complexities and the nature of adolescence, like was articulated initially in the introduction, it makes it even an excellent tool to able to a little bit dissect a little bit the complexity of it. So the pre-morph phase is a critical one, and it's one where we have a lot of factors that interact with each other. And it's also important to understand the transition to the next phase when you understand isolation, etc. And as an example, like every individual trajectory would be very different, but there should be a way to able to understand at least the process that lead to them. Either it's negative life events, and then your gender and age interacts, and then you feel humiliated, isolation, poor emotional management, etc., poor social support, and then that leads to social planning, etc. And like mentioned, I like that exact number of 42% are sort of like generated individually, and 58% is your environmental context. So it also offer like some good thought process to see, how come interventions, before things become too serious, how can we identify these ability to interact and prevent? Aishwarya, you want to go to next slide? The other one is gapped in available data. I think we all understand that it's extremely difficult to track linkages between ideation, planning, and the act. We see a lot in the news report. We saw a lot of data on suicide. So that is the outcome. But we also know that the risk factor is huge. So when you see in a funnel, we're sort of like at the end of the funnel where it's more narrow, but there should be scope to understand and gather data in much initial phase, even alternative sources of data that we can think of to help us, model, and even at an individual level as well. I think we also need not only a one-time data set. I think it's something that we need to think through, like, how to access something reliable, timely, and comprehensive, given the dynamic nature of a lot of aspects and the factors as well. This is where I think maybe there might be early stages, but there could be a huge potential for even things like AI and machine learning to help identify combination and depth of risk where we can. It's hard for, like I mentioned, individual to say, okay, these are 3 factors that can potentially lead to suicide. Is quite impossible. But if you have some ways to compute, identify the early stages, something that could help and prevent, I think that could be potential to explore. We also have a few recommendations, and these are extremely broad-based, by no means, but these are just summarized. The first one is stakeholders that are very pertinent to, the adolescent. And I think there could be several levels of training. And when you talk about training on such aspects, one often has the idea of financial constraints or even time constraints. So there could be ways where I think there's a lot of innovative models that help identify, either groups, locally, solutions like students as peers, teachers, parents, community leaders, volunteers across rural and urban that can be trained as first responders in identifying risk factors. And I think providing first aid and referring to other services based on need. I think there are already a lot of probably models there that can be mimicked, scaled up, tweaked, and particularly for this adolescent segment and different geography areas, depending on that. I think this is something that probably intuitive as well. Suicide prevention or health promotion strategies, they need to focus on promoting the general health of the population, given the sensitivities of mental health and suicide topic as a whole. A lot of them, even some that are less intuitive, like it was highlighted that even like adolescents' diet could also be a trigger to mental health. So even thinking of like the promotion of good food, exercise, and healthy behavior toward technology are all things that I think can easily be integrated in sort of like even a school curriculum or an education curriculum that can have a huge outcome on people's health, mental well-being, and eventually also on tackling the suicide factor among this young population. Ashwar, and obviously like improving research around suicide in India. So there's often a huge gap, but I was happy and very pleased to hear some of the insights and the factors already that have been identified. So I think the call for robust data collection assessment are there. I think looking as well at innovative ways to look at it, but also making sure that the more vulnerable communities are included: refugees, migrants, street children, shelters, LGBTQ community members, indigenous communities. These are all people that were not really present in the data that we saw, whether it's news or journal articles. And there's are portions of communities that are highly subject to mental health and suicide. And I guess more finding research tools, validation, intelligent idea to action. Having worked in a lot of like research, action-oriented research, the idea of testing solutions on the ground, iterating and really arriving at solutions on a community-based level and learning from each other, I think that's quite critical. So I think I'll stop with that. And the last recommendation would give insights on if there's any issues on suicide, etc., to reach out. And this is information here. Ashwar, do you want to articulate on this organization?
No, we just wanted
Okay.
to say this in case.
Great. Okay. Thanks. Thank you.
Okay, thank you, Sharon and Aishwarya, for your presentation on the insights that we sort of got from our meta review of the study. Now I'm going to introduce you to the panelists who have been listening to the presentations from different studies and also from what Dr. Lakshmi said. So let me start by introducing you to Akshaya, who's our youth representative. Akshaya, you here? Is she? Yeah, I can't see her. Is she there? She was around. Anyway, Akshaya was, well, basically she's currently interning with us, and she's a professional badminton player at the national and state level tournaments. And she's also completed a diploma in fitness and nutrition from Calcutta. It's really, we're very happy to have Akshaya to represent the youth, and she was in, but I don't know what's happened. She's logged out. Let's see if she joins back. And then, of course, we have Mr. Neelakantan, who represents the education sector. So Neelakantan is basically from, he's on the governing body of Madras Seva Sadan. He's involved in their sports activities and also helps with the infrastructure and performance of the schools. Of course, Neelakantan also is involved, he sort of put together a curriculum on voice acting and creative writing for the Manipal Institute of Media and Entertainment. What's interesting is Neelakantan's also agreed to represent a parent. So it's a dual role. Thank you so much.
Thank you. Thank you for having me.
And he was the anchor voice for the live transmission of the PSLV C6 rocket from Sriharikota, which I thought was quite an interesting element in his bio. And does a lot of live stadium announcements during IPL cricket matches, and a quiz master too. He's done a lot of productions on Chitty Chitty Bang Bang, The Chocolate Factory, Joseph and His Technicolor Dreamcoat, and the Mahabharata Abridged, and so on. So it's really wonderful, Neelu. He's given his voice for Walt Disney and Chandamama you know, and so on. So we're glad that you're here with us as part of the panel. And then we have Arjun Kapoor, who is the program manager and research fellow at the Center for Mental Health, Law and Policy. And he's, of course, a lot of prolific papers with Dr. Lakshmi. He's a lawyer and psychologist with experience in human rights and access to justice and mental health. He's facilitated capacity building for over 3,000 formal and informal stakeholders to implement the India's Mental Health Care Act and the National Health Policy of 2014 and 2017. He's developed and co-led the Keshav Desiraju India Mental Health Observatory. It's a repository of data and information on mental health laws, policies, to promote evidence-based policy for mental health in India. Currently, he was, of course, involved with Outlive. It's a youth suicide prevention program to address urban youth suicide in Delhi, Mumbai, and Pune. He was also part of Engage, which is an adolescent suicide prevention program to train school teachers to identify and support and refer at-risk adolescents in Chhattisgarh. And this is really awesome. And we're so grateful to Arjun to be part of our panel. Thank you so much. Of course, now I'm going to hand over the mic to Dr. Ramesh, who's a Deputy Director of Training and Education and Research at BALM in Kovalam, Chennai. Ramesh is actively involved in training and capacity building for all our projects, Nalam, Home Again, ECRC, and and also our master's program, which is coming up at MSSW. So over to you, Ramesh, to moderate the session. Thank you so much. Thank you.
Thank you, Dr. Lakshmi, ma'am. It was a
Yes.
wonderful, presentation of a study. So yesterday, when I was watching news, I saw a news that there are more than 10 students, died by suicide after school exam results were released. I was sharing with many of my friends and families that this event is at right time to talk about the issue which is already happening and it's growing. So I'm very happy that we are at right time talking about this issue. So we have around 30 minutes for this panel discussion. So all our panel members, I request one by one to share your general view about the study findings, starting from Akshaya, then Mr. Neelakandan sir and Mr. Arjun. Akshaya, you can go first. I request not just 1 or 2 minutes on each of these themes or questions that I'm going to pose it to all of you. Thank you. Akshaya?
So I have to talk about like how they attempt suicide, or what is it, sir?
No, this particular study has listed a lot of findings or insights for all of us. So any views about this particular study?
I think it may be due to exam fear also. Like if they haven't studied before the exams, they haven't studied a lot, or they have studied and they will be very nervous that okay, they'll just assume that the exam paper may be very tough or anything like that, and on that toughness nale they'll like full confidence will start going down. So when they come to the exam hall, they'll sometimes like they'll be very nervous and they'll start even overthinking stuff like, okay, if I should attempt this question, but they'll write the wrong answer, and they will, after the exam gets over also, they'll be discussing to all their friends like, okay, I'll get this much of marks. And then when they don't get the actual mark what they wanted, and I think these are the issues like it may lead to the suicide.
Thank you. Thank you so much for highlighting one important area, which is the pressure, during exam, post exams and things like that. So I welcome Neelakandan sir, your views on the study findings insight.
Thank you. The study, from what I had read earlier in the presentation that Aishwarya and Sharon made, was very interesting in what it was gleaning and its outcomes from the surveys. But the one principal thing that always stands out to me is that whatever the triggers that have been there, which are there now, aside, of course, of the extra, which is the internet and social media and things like that, the triggers have existed even when we were children. Be it examinations, be it strict teachers, being scolded by your teachers. We used to get caned. There was a whole lot of all that happening. But what strikes me as much bigger is this generation of children, the adolescents as we are calling them, are a lot more fragile emotionally. This, as I am not an eminently qualified person in child psychology or anything like that. I'm coming from the point of view of one as a parent and as a person who's involved with children on a day-to-day basis at our schools. And I work closely with all of them. And what I do find is how emotionally fragile they are. And that in itself is a huge factor contributing towards potential suicide, suicidal natures, children even contemplating or being so, having precious little value for their own lives, not realizing what a precious commodity it is. And they are willing to just forfeit that in a flash. And it's just that fragility, and I will talk about this later based on the questions you're going to ask of me. So this is where I'm coming from in terms of why I think principally children these days are heading towards suicide, taking the easy way out, or is it the more difficult way out? One can never say that between about suicide. Is it the easy way out or the difficult thing that to do? But I feel the fragility of the children is very important to look at. So I will stop with that for now. And as we go along, I'm sure there will be more I will be able to contribute.
Thank you so much, sir, to talk about what is the current status of our children from your own experience. I welcome Mr. Arjun to share your views about the study, sir.
Yeah, thanks very much, Mr. Ramesh, and thank you to BALM and Krea for this opportunity. I'm very happy to be here. So I haven't had much of an opportunity to look at the study in detail, so I'll refrain from sort of commenting on the specifics. But from what I've heard from the presentation, I think one thing that definitely stands out, which I'd like to emphasize, is the multifactorial nature of suicide in itself. I think we have to understand that suicide is an extremely complex issue, and it's never one factor which is at play, even though the way things are reported in the media or in journal articles tend to sort of simplify some of the factors that are actually impacting in a young adolescent's life. I think one has to look at risk factors in a more complex way. It's always an interplay of different factors, and it's a combination of what's happening in the adolescent's individual life. How are their relationships structured? What are the interpersonal relationships like? What is the kind of support environment that they're living in? What are the kinds of support that they have access to or don't have access to? And then, of course, there are factors at a community level as well, or at a societal or a macro level. So I think one has to kind of look at the phenomenon of suicide in general, and also specifically adolescent suicide in a more complex way. And of course, with adolescents, there is a specificity in the sense that young people in that phase are going through a tumultuous time. So there are additional factors of just the experience of adolescence and what's happening at a physiological level, what's happening at an intellectual or an emotional level. So I think that's one major insight that I definitely sort of agree with. I think the one of the things I just wanted to emphasize, and which struck me, because one of the sources of the articles were newspapers themselves. And I think we also have to understand that media reporting around suicides is a huge problem. It is also a risk factor. If you analyze how media reports about suicides, it's often not in compliance with the guidelines around media reporting, right? So what we've tend to notice even in our work and our research at the center is that often when media reports suicide in an article, it tends to, of course, sensationalize the issue, provide a lot of explicit details, which are very problematic because that can increase the risk of suicide amongst people who are already at risk. But it also tends to simplify the factors that have led that particular person or that adolescent to attempting suicide. So I think that's one thing that we should definitely keep in mind when we are looking at how the media itself reports suicides. I'd just like to build on Dr. Lakshmi's point around social media. I think, of course, we've looked at a range of risk factors in the study and otherwise also, but I think social media, particularly in today's time, is a huge factor. And a couple of years ago, in fact, there was an expose by the Wall Street Journal which talked about how Instagram, and there is internal evidence to suggest that a platform like Instagram is actually increasing the risk of suicide and mental health problems amongst teenage girls. And so how is social media in that sense being seen or regulated? And I think here there are two aspects. One is, of course, the kind of content that young people are engaging with on social media. So the dissonance between their own individual lives and the lives that they have to project online, and also the dissonance that comes from observing the lives of their own peers, and the kind of pressure that it puts on young people. But the second bit is also about how suicide or mental health problems or distress themselves are represented on social media. And this goes back to my point about media reporting and how suicide is talked about, in a public context. That in itself is a huge problematic factor. The last bit that I just wanted to emphasize, and the presentation slide did talk about it, is also to look at the impact of structural discrimination, and specifically in terms of caste-based discrimination, or young people who identify with different genders and sexualities. Now, there's a lot of research in the West which has been done to really show how gender, sexuality, or race-based discrimination actually leads to adverse mental health outcomes, including the risk of suicide. Anecdotally, and through a lot of work research work which is done by organizations in India's context, whether they're anti-caste organizations or organizations working on gender and sexuality, we know that this is a huge risk factor for young people, in terms of the microaggressions that young people might experience in schools or colleges, or the gender-based sexuality discrimination that they'd experience in their interpersonal relationships, or even at a macro level. It's only a few years before when homosexuality itself has been decriminalized.
Sorry to interrupt,
yeah.
Arjun sir. I think a lot of topics to be, are lined up in the areas that you already mentioned. I think one important takeaway from what you said is how to report in media, how not to report in media. I think that's a very important message that these studies also help us to, understand better. Because you talked about, technology and, media addiction, I just want to ask Akshaya, because you went through this phase recently and now you are in a college. What are the difficulties to, manage this social media, peer pressure? Because it's very easy, for us to say, it can be managed well and things like that. But what is your view?
So I think so for example Instagram, if now everybody is onto Instagram, everybody loves Instagram, Snapchat, and they're so indulged that if you're not in Instagram, that means you don't have your own identity. That's how it is right now in the current situation. Even I had my Insta ID even when I was only in after 12th. I had before, when I was in 12th, my friends were you don't have Instagram, or what is this? Nee edum post panna mattiya, what? There's no update about your life or nothing. Everybody should know. So there's no privacy in the entirely. There's no privacy, and people don't respect okay, if they're not there, means if they're not there, just leave it. But they just ask are you there? Are you not there? They just indulge in others' life through Instagram. Yeah.
Thank you. Thank you for highlighting how you're all pressurized, to get into the social media and retain it and spending more time on updating each and every minute of what you are doing. I think that's how you are all, spending a lot of time on it. I think with that background, there is one,
Can I just add upon that,
yes,
Rakesh?
sir, please,
Huh?
please.
I totally agree with what Akshay is talking about. And I think Arjun also touched upon it when he spoke about the social media situation, in that children are now, and indeed to some level the adults also, are leading their lives very vicariously. When I say vicariously, they're living their lives based on everybody else's lives. So what she says is, when everyone's constantly questioning what's happening with your life, I don't know what's happening. So the question is, so what if you don't know? Why should you know what is happening in my life? But yet there are all the people the children especially, who have to perforce put their lives out there, whether it's the truth or not. And that's what Arjun was also talking about, in that a lot of it is even made up, right? The entire thing is kind of a figment of a lot of people's imagination, because they want others to think that they are doing extremely well, whether it is academically, or whether it is, the places they are visiting for holidays, where they are going to eat, what they are eating, right? If they don't photograph and post what they have eaten for lunch that day, a lot of people will immediately ask questions. Why didn't you tell us what you were eating? So that pressure is also hugely there for the children in social media, on Instagram and all that, and having to live a better life so that they can project it to others. And that pressure is also huge. It is really huge on the children. And Instagram also, just as an example that I have witnessed in one of our schools, is when there was, say, in a co-educational school, when there is some little thing happening between a little boy and a girl or something, there would always be some graffiti or something in the bathroom saying so-and-so loves so-and-so, the heart shape with the arrow and stuff like that. But now all that is on Instagram. They are putting it out there, and parents are going up in arms saying, how can you put it up there? Right? So, and further about what she was talking about in terms of examinations, the pressure of examinations. That again is pressure that we are putting on our children, and the children should not have that. The amount of pressure they have for their board exams, their public exams, is incredible. And I for one, was totally against it and told my son, it is another exam. You study hard and you study through the year and you will do well. It's not about, you get good marks. You do well, you're going to get good marks. Don't sit and give yourself a benchmark that I have to get 98%. This is what we parents put on the children. And that is why the children are suffering, right? Parents need to be sensitized and educated on the fact that they should be chasing an education and not marks. That's what they should be giving their children, right? So, yeah, I'm very passionate about this. You'll have to stop me if I keep ranting.
Thank you, Neelakandan sir. I think what you brought is a very important point about how the pressure is exerted on the children and things like that, both by the environment as well as the school management system. With that background, I invite Arjun sir to talk about how the schools can be of helpful, because one of the insight is also the children struggle to manage relationships at school, whether it's teacher or fellow students. Any attempts done based on your own work experience, Arjun sir?
Yeah, thanks. So I think schools are an extremely important space for any kind of suicide prevention work or strategy with adolescents. And what I would think is that if you're looking at schools, then one has to look at a comprehensive approach. I think one of the things about suicide prevention is the one size fits all approach does not work, because it is so complex. You need different strategies, and there are different stakeholders who are involved. So I think at a school level, one is, of course, to address some of the sources of the stresses itself. So for instance, if there is bullying happening amongst young people, then there have to be sort of enough sensitization workshops or interventions that are addressing some of the sources of those stresses itself. I think the second strategy is to really look at early identification and preventive work. So training teachers themselves and school administration and school staff to be able to identify warning signs amongst in adolescents who might be at risk of suicide. And then doing a risk assessment to see whether or not the young person is actually thinking about suicide, or have they made plans to attempt suicide, or are they at immediate risk of attempting suicide. I think providing immediate emotional support then becomes very critical, and then referring that adolescent for further support and care. So I think this is what we conventionally call gatekeeper training programs, which is, I think, extremely important. I think the third aspect is to look at peer education in itself. So building capacities of students themselves, of young people themselves, to be able to support their peers, and provide that referral support in case, a young person might not be able to approach a teacher or an adult in the school system. And this is something that from our own work we have experienced a lot, and a lot of feedback that we get from young people is that one of the biggest barriers is the teacher-student rapport in itself. Because students often don't feel comfortable going and speaking to a teacher because of the relationship. So
Sir, sorry
teachers
to
themselves
interrupt
need to
you.
be taught. Yeah, just
Sorry
let
to
me just
interrupt you
complete
with-
the line. Yeah, just teachers themselves need to be trained to be able to build that rapport with students and to be able to provide that emotional support. Yeah.
No,
Totally
the
agree.
reason why I want to just interrupt is to bring Akshaya. How far these approaches are feasible. How do you think the youth will see this kind of opportunity as a peer educator, a peer supporter, or a first responder that the study also talks about? How do you see this intervention Arjun sir talked about?
So I think he was also mentioning like a teacher and peer relationship, that's very important. So there are a lot of instances, like in my class, a lot of incidents took place, like a teacher like barging at my own friend, like in front of everybody, just insulting her, and just because she was into some sport and she never used to come to class, and she used to not attend classes, and then she comes like in different days she comes, and they're like, how can you come at this time? Then she insults her and tells her like this, and too much of insult she does. And one point of time she gets very frustrated, and she's like, okay, I'm done with this, like how can this teachers talk like this, is not nice. So she comes and talks to our peer group, or she comes and talks to me about it. So we give her like saying, okay, just calm down, let's talk to our parents about it, like what's happening, this is what is happening in school. Yeah, I think even talking to parents is one thing. Like if you're comfortable talking to your mother, you can just go and share, like not having a sit back, like thinking, okay, my mom is not going to help me out. So I think even the mother will take a try taking a step because somebody has told something bad about their own child. So I think that is one factor.
So peer-led model will work, through the friends and things like that. Yeah, I think that brings another question to Neelakantan sir. I think a lot of efforts done at the school level. I think you are also part of the promoting sports, but outside that, what is the kind of role the social environment should play? Because in the school they spend only around 8 to 9 hours maximum. And you would have seen that there are roles played by the environment makes a huge impact on this issue of risk factors or a suicidal behavior. Any views on it, sir?
Certainly. Jim, just to expand upon what they had also said so far, to give Arjun an idea as well, in our institutions itself, we adopt an open door policy with the staff. So the children are encouraged to approach their teachers all the time, whether it is for academic issues or personal issues as well. And our teachers, we take them through workshops and to sensitize them. And Lakshmi will tell you that I used Banyan to come and do some workshops in our school, sensitization to our teachers as well. So this is something which I would think all schools should do, while making it easier for the children to approach their teachers and take care of it. It is also important for the teachers to realize that they are de facto the children's parents when they are in school. and not at home, right? So they play a huge part in the development of a child, in the growth of a child, in the molding of a child. Now, on the flip side, in terms of what they need from home, they need a lot more emotional support right from the start. The support has to come from the parents, right? Now, I personally feel that generationally there is a problem which is happening where parents, one, do not have as much time for their children, right? So there are a lot of nanny syndromes happening, or the IR syndrome, as you'd say. And that, I mean, that's not across the board, obviously. But a lot of the children, even the low stratas and stuff, do not have that emotional connect with their parents because the parents do not have the time for them at all, right? So sensitizing the parents about how to bring up, parenting itself is a very important issue for the children. I mean, I know some parents who, when their children have a problem, anything, they throw a tantrum of some kind, and children are prone to tantrums. It's part of their job profile, as you'd say. But the first thing they do is up and fix up an appointment with a therapist. So they are not doing anything towards helping the child because they themselves don't know what to do. I'm not blaming the parents here, but I'm saying you need to, and I'm talking about 5-year-old, 6-year-old children who are being taken to therapists and being told that you have a hormonal imbalance, there's something wrong with you, we have to take care of you. And children at that age do not need that, right? And they are grappling with so many issues at their age, right from the age of 5. Now, even the biggest issue, which is their own gender identification. They are so confused about what they should do one day. I know children who are one day coming and saying that I am gay. The other one is saying I'm the same child says something else the next time, identifying with somebody else. And the latest one, which really took me by surprise, is when somebody came and told me I'm a furry. And I'm like, what's a furry? I identify with a cat. No, so they are dealing with a lot of confusing aspects to life. And it is up to us to create that environment which gives them complete emotional support, which will give them emotional strength. The emotional quotient is not there at all. It's very poor.
Thank you, sir.
very
Sorry
poor.
to interrupt.
No
in
problem,
between.
please. I told you I'll
I
keep
think
talking.
we are closer to the end time of the panel discussion because we also have a Q&A with the experts like Dr. Lakshmi Vijay Kumar. So I just want to ask few questions before we close. One is to Arjun sir. Sir, what is the future looks like in this kind of suicide behavior prevention and promoting a healthy lifestyle? How should we look at our future?
Well, I mean, in terms of from an intervention research point of view, I think we need more robust data. I think that's critical. Currently, suicide data is collected by the National Crime Records Bureau, which by all means is a huge underestimate. The NCRB also doesn't collect data on attempted suicides. It doesn't give us a complex picture of the different kinds of factors. We don't know how the NCRB actually allocates a particular suicide death to a particular issue or a risk factor. And there's a lot of ambiguity around that. So I think we need better quality data surveillance systems that can enable us to develop better interventions. I think we need robust community-based interventions, especially with young people, because young people often rely on their social networks, whether it's social media or their peers in school or a teacher that they trust or a friend. So we have to think of community-based interventions and really leverage the advantages that community members themselves can bring, because suicide prevention is something that all of us can do. With a bit of training, all of us can play a part in being able to identify at a very early stage if a person is at risk or an adolescent is at risk, and then provide them that support. And I think the third thing is to really look at some of the risk factors themselves. So we've talked about academic stress. We've talked about some of the things that Dr. Lakshmi talked about in her opening remarks. I've talked about caste-based discrimination, gender sexuality-based discrimination. There are a range of risk factors which are operating at a community and a societal level. So I think also looking at interventions which limit exposure to those kinds of stressors and building and really building on the protective factors of young people, building support systems instead of putting all of the pressure on them to be able to constantly deal with the problems in their life. It's a different world that we're living in now, and we also have to change according to that and build systems that can respond to their needs and their challenges.
Thank you, sir. Thank you. Thank you for it.
Totally agree with you.
Ms. Akshaya, I think as a youth representative, how the enabling environment should look like for anybody with the suicidal ideation or those who are at risk.
So I think first, talking out is the main factor. Saying that I am not, like, if they're feeling isolated or if they're feeling a little down also in any day, they have to talk it out to the closest person they are like in contact with. So it can be a friend, it can be a cousin, sister, or a brother, or it can be an like if you have a neighbor who is very friendly to you and you know them from childhood and they're very close to your heart. Now you can share things with them. I think sharing is the key point. Yeah.
Thank you, thank you, Neelakandan sir. Now I just want to think from a parent perspective. How a parent should approach this when they come to know the child is at risk for suicidal behavior.
So to take a line out from Akshaya there, first thing you need to do is draw your child out. You got to let the child speak. You have to be available to them. Your ears should be there, and they should know that you are available there to listen to them. And most often, just talking about your problem gives you a perspective on it straight away, right? And I remember when my son was younger, he's 19 now. So I've been going through this adolescent thing for the last 7 years now. So I'm quite aware of what it is. So we used to make him write it down. We used to make him write it down and read it. When you see it in black and white, it gives you a better perspective, right? So it's a question of being there for them. That's all I keep saying. It's not as if any of us is trained in parenting. There is no one size fits all. There is no formula to parenting. Every child is different. Every child is unique. Every child has to be treated differently. So every parent makes their own mistakes. It's always a new mistake, right? So we have to also learn to skill ourselves in listening to our children and understanding where they're coming from, what their problems are. And if we are able to help them personally, we do. We can. Or we read up on it. We find out about it. And how can I help my child with whatever it is without him getting his back up about it or getting confused by it? And without knowing, we should not ourselves go into being their psychologist or their psychiatrist or whatever.
Thank you, sir. Thank you. Sorry to interrupt, sir. I think it's time up for the panel discussion. I thank all the panel members for joining this very important discussion, sharing your views. I request Arjun sir to just be available because we are also opening up the Q&A with the experts. So thank you all. Now I'm inviting Dr. Lakshmi Vijaykumar ma'am to share your views, because there are a lot of questions that we thrown to our panel members, but you may have some views, but we do have some direct questions to you, but feel free to share your views first, and then we'll go with the question, ma'am. Your mic is on mute.
It has been really wonderful listening from a young person, from a parent, an educationist, and a person who has worked with the young people for the last 10 years or so. So it has been really wonderful listening to all of you. But I want to pull back to the study, because that's what this meeting is about. And I'll take a couple of minutes to see how this module developed. Okay. First, it was the stress diathesis model. Then Joyner developed this interpersonal module. Then Rory, because he's a cognitive person, he's a behavioral psychologist, he worked on, for his the research has been on defeat and entrapment, and he introduced that module. And then Olivia was his PhD student, and she talked about the volitional factors. And actually, last year, they came up with the new module where they focus mostly on the volitional factors, and which is what the transition happened. And actually, 1 week back, there has been a systematic review of all the studies which has been based on IME, which has been published in psychological reports now. So the only caveat to the study, which I have to say, is the fact that this IME module, as they have said, is not being used for adolescents. And actually, it doesn't fit in for the full life cycle. Particularly if you take for below 14, 15, the feeling of defeat, entrampment, and all that doesn't really fit in. Which is why if you look in your study, you'll find very low in volitional factors, whereas all the pre-suicidal factors will be there. Okay, so you don't find much in the volitional factors because that's one of the drawbacks of this module, and also that it doesn't give prevention. Anyway, that is beside the point. What can be done to prevent youth suicide? Okay, that is the major question here. The fact is, most of the time we think it is something which we cannot do. I'll just share a small example. See, everyone was talking about academic stress. Okay, when we started Sneha, actually we found a lot of people. We were working from morning 8 till night 10 o'clock only. Then during the exam results May, we had so many calls which said that they were feeling upset, distressed, and so many students. So for the first time, we became 24 hours for that 1 month. And the number of calls from students increased. And we found a study that majority of the people who died by suicide had failed in 1 or 2 marks. Okay. Or there were people who wanted 90s and got 80s. So armed with this, I mean, media is a double-edged weapon, I would say. So we actually worked a lot with the media, went to the government, and we were able to make the Tamil Nadu government, and Tamil Nadu government was the first government to start the supplemental exam in 2003. Okay, so and our effort has been even written in the Economist. So if you really look at it now, from 2004 to 2022, in Tamil Nadu, the number of people who died students who died because of exam failure was 450. And in Chennai, it was 54. In 2022, it is 112 and 7 in Chennai. So there has been a huge reduction in exam failure. But again, I have to say, unfortunately, what has happened in Tamil Nadu is the number of love failure suicides has increased. A lot of love failure suicides because of the media projections, the whatever it is, the love failure suicide. So there is a changing pattern. Okay, so suicide risk or protective factors is not a static phenomenon. It is an ever-evolving phenomenon, and we need to be available for that. And that is why this kind of module, IME module, helps us because it has a lot of modulators which we can keep adding. Okay, but one of the criticism about the module is that it has not included certain factors like decision making, because one of the major criteria, one of the major factors which are found for adolescents making a suicide attempt is because of deficiency their decision making. They'll make the same mistake again and again. They won't learn from that mistake, So that is one of the factors which we are talking about. So what needs to be done is actually a summary of what everyone has said. We have to have a top-down approach in terms of systemic changes, policy changes, provision of spaces, and so on. And we also need to have a bottom-up approach from the schools, and the non-school settings also. Okay, the marginalized children, and both have to seamlessly work together if we have to save young lives in India.
Thank you. Thank you so much, ma'am, for the overview about the suicidal behavior as well as what can be done, and the model that you have developed, Sneha, very helpful and motivational for many others also to enter into this. I saw one interesting question from Dr. Nachiket Moore, sir, who is also a very important supporter of this study. So what he says is the IMV model, the motivational factors of feeling of entrapment and perceived burdensome. These are the two, areas which are important for adolescents. Is there any way to, address these, motivational issues, entrapment and perceived burdensome?
Actually, as I said, one of the things which we have been talking, I have been talking, Rory and Olivia are good friends, so I've been talking to them. One thing, if we have to have a module separately for adolescents, one of the things which you are talking. And there, apart from defeat and entrapment, particularly for young people, the emotions which triggers them to suicide are two. One is shame and another is rejection, which doesn't find itself such an important place in this module. Okay, which is why I said this module is good for not for the very young, not for the very old. Okay, so it doesn't have really a life cycle approach. Okay, which is what we would like to have in a module. So probably we have to add that. So we have been discussing about that with Rory, whom I'll meet next month. But this is what we have been talking about. Because apart from this, ask any young people anything which causes shame. For example, being pulled up in front of others, caught copying, those are the things which causes them. And the other is rejection. When you reject somebody, at that age, their self-esteem has not developed sufficiently for them to feel, okay, if this person doesn't like me, I don't care. No, that makes a huge difference to them. If somebody whom they like rejects them, that is the ultimate pain an adolescent can have, because they are still evolving as a person. So at that time, if somebody whom they care for rejects, then there's a problem. So shame and rejection are two driving emotions for a young adolescent.
Thank you, ma'am. This one more.
Does that answer your question, Mr. Nachiket?
I think he's on mute.
I don't
Was
know
that the question he asked? Or
yes, I read it out from the chat only. I think with the paucity of time, I'll just move ahead. Sir, one question which I think it should be addressed to Arjun sir is this particular study, used English newspapers and a particular period of time, and again newspapers also from a particular location. So do you think it will also have an impact on understanding the suicidal behavior in other regions, maybe the other, local newspapers, local language newspaper reports? Arjun sir, your
Lakshmi,
mic
I
is
know
on
you
mute.
want to say something, so please come in and then I'll come in.
yeah, I mean, this is another
Yes,
thing
ma'am.
which I wanted to say. In this study is not a good fit for putting newspaper reports there. Because as Arjun was saying before, most of the newspaper reports thing is monocausal. They will have one cause for suicide. Whereas this module, you need to have all the factors put into that for a thing. So if you are planning to publish this study, remove the newspaper part of it from there, because people will object to that completely. So this module is not for deriving information from newspapers, honestly. That's all I wanted to say.
Thank you, ma'am. Arjun sir?
Yeah, I think Lakshmi's partly answered that question, but I mean, in that sense, I think there are two parts to it. Of course, adolescents across the board do experience similar stressors. So there's, whether it's in a rural context or an urban context, things like academic stress, relationship issues, lack of access to support, all of those things are, in that sense, common across the board. But I think then there are also specific, because young people themselves are a heterogeneous group, right? And so there are different communities within young people themselves, which might be exposed to specific stressors. And I just want to take a minute to build on what Lakshmi was saying in terms of, having an adolescent specific module, but also looking at how shame and guilt, shame and rejection affect young people. Now, there's been some very interesting work done on the minority stress theory. If some of you are aware of how gender and sexuality-based discrimination leads to adverse mental health outcomes in young people and older people as well from the LGBTQ community. Now, the minority stress theory talks about how there are certain distal factors, such as a discriminatory event that has happened, or prejudice or stigma. And then there are some proximate factors or stresses in a young person's life which flow from those moments of discrimination and prejudice, which can lead to something like internalized homophobia, or a constant sense or fear of being rejected or being discriminated against, or a fear that you will be outed to the community. So you're constantly trying to hide your identity and conceal your identity. Now, these are factors which could directly lead to an adverse mental health outcome, but it can also impact a young person's general coping mechanism. So whether it's emotional regulation or it's their interpersonal ability to get support or social support, or their own cognitive schemas, so feelings of hopelessness, and so on and so forth. So I think there are also some particularities which apply to specific youth groups because they are exposed to specific kinds of stressors. And it's important to understand those pathways as well to see how those then lead to other problems, including suicidal ideation and attempt and suicide deaths.
Thank you. Thank you so much. I think we are running behind the time as per the schedule, few minutes. So over to Dr. Lakshmi. Thank you, Dr. Lakshmi Vijaykumar ma'am and Arjun sir for answering the queries in detail. I hope there are more questions, but because of the time, lines, we are going to close this Q&A. Over to Dr. Lakshmi Sankaran ma'am. Thank you.
Thank you all. And Dr. Kishore, are you online and could you have your video on, please? We would like you to come in to conclude the session. Just adding here, Dr. Kishore is our director from BALM. He's also, extensively involved with our Home Again programs, ECRC programs. And importantly for us, he's also been one of the contributors to the Life Skills Manual for schools, prepared by NIMHANS that many of you are familiar with. So it looks at different grades of schools, and it's been translated to Kannada, Hindi, and so on, available. I'm also curious, Dr. Kishore, how do these, because we've also been hearing about how prevention and empowering young people is important. So, Dr. Kishore, could you kindly come in and give your concluding remarks?
Thank you, Lakshmi. It was nice to be part of this proceedings for the last 1.5 years. 1.5 hours. We have discussed many issues. To conclude that we know that suicide is going to be part of our life in the universe, no matter what new interventions we bring. We have identified the variable rates of suicides across different studies. Insofar as this study is concerned, that reporting from the newspaper reports is notoriously unreliable because they can exaggerate, romanticize suicides, and therefore they will present a very biased view about what is the actual problem. The next issue that has been brought about by the other panelists are the role of the parents, role of the schools. Insofar as parents are concerned, it looks like in their race to gather monies, in their race to work hard, in their race to get fame, unfortunately, children are being neglected, and therefore, as many panelists have said, that the role of parents is getting minimized, and therefore today the parents are internet, the television, the mobile phone, and the peers. Whatever information comes from them is becoming a new norm. Unless this changes, we will not be in a position to do much intervention, because the partner for our intervention has to be a parent. So we have three partners to impact lives of children and save millions of brains: is the teacher, the parent, and the facilitator or the life skills educator. Unfortunately, even though we have very clearly aware about the raising suicides, I don't see a clear policy about what should be the clear intervention program. So if you take this to the teachers, they say, no, we don't have time, and therefore completing syllabus is the most important thing that we have to focus, or else we will get reprimanded by the government. In such a situation, if the schools are not able to create space for building competence, engaging children in activities in the school, so that they are able to build soft skills, life skills, use of life skills manuals is going to be important. If there is no space created for that, then there is no opportunity for them to learn. Dr. Nachiket Moore raised a very important question. That was about, can we detect suicidal behavior before it is completed? He talks about a tool called as PHQ-9 and the reliability of item 9 of that particular tool. Yes, many such studies exist. Unfortunately, detecting this may not translate into prevention. For example, in Australia, they did a study to look at primary care physicians, and they have found that many depressed young people committed suicide after meeting a primary care doctor for consultation. So the outcome of that particular thing is the primary care physicians failed to recognize the suicidal ideas or suicidal intent in these children or in these subjects who consulted the primary care doctor. Then coming to the interventions, whenever we talk about young people, interventions that is necessary needs very strong motivation and a proactive policy driven by the government, and multi-sectoral collaboration is absolutely necessary. The Department of Education, Department of Health, Department of Social Welfare, and the Department of Finance will have to put together their heads to say how much investment is necessary and how to save lakhs of children who are going to commit suicide, because the environment is not going to change very significantly. If at all, it will get more and more complicated. The next important issue here is the role of the schools. If the schools adopt a very child-friendly policy and they are willing to build competence in young people, a significant impact can be achieved. But also remember that the impact of reduction into suicides is too small a time that is available for teachers. Suppose if you start the program in 8th standard, we do it over 9th and 10th standard, 3 years is too small a time to understand the impact of these kinds of interventions. So if we are looking at the situation of adolescents and young people, We are only looking at the tip of the iceberg. Underneath is a complex set of factors, and the key stakeholders will be parents, school, communities, significant adults, and rest of the other people who have to work on. For example, the impact on adolescents significantly comes from role models of their heroes, or parents fighting among themselves, abuse that happens in the house, and of course the romanticized stories that happens. For example, yesterday in Telangana, 7 children committed suicide after the results were published. Can there be anything more dramatic than this? I feel very sad that we are failing these young lives because we are not able to do the competence building in them.
So Kishore,
There
I'm
are,
sorry, Dr. Kishore, sorry to interrupt for lack of time.
let
It's
me finish,
yes,
Lakshmi.
yes. Thank you.
There are interventions that has been done which is very innovative. For example, in Tumkur district of Karnataka, the MLAs worked with the parents, schools, and families, talking about the difficulties that they are likely to experience before the exams. The results were wonderful. They found very significant reduction. For example, if there were 10 suicides, it was reduced to 1 suicide. With this, I will close. Thank you, Lakshmi.
Thank you, Dr. Kishore, for giving us an example from Tumkur where, there's been some kind of, intervention that's been helpful. I have one question maybe to Dr. Lakshmi Vijayakumar. Is there any best practice that you could sort of tell us about? Any best practice intervention?
And there are, the only problem is there are too many best practices which have not been found to be as good a best practice as possible. The only thing is, the fact is that there is a new one which has come from the WHO. It's called HAP. It's called Helping Adolescents Thrive. Okay, it is a toolkit, and it's also an what shall I say? It has a toolkit, it has a guide, it has a thing. So it basically looks at how adolescents can be helped through for mental health issues and suicide prevention. Not specifically for suicide prevention, but generally to improve mental health and suicide. And there are 4 factors which they have identified, which focuses. And one is problem solving ability. Another is emotional regulation. Third is help seeking behavior. And 4 is a good referral pathway. Okay. So these are all the factors which it is there. I think if you go to the WHO website, it is developed both by WHO and UNICEF. We all sat together. So it's called Helping Adolescents Thrive. It's only for emotional mental health.
Wonderful.
Particularly focused on low and middle income countries.
Low and middle income countries.
Low and middle income countries and universal strategies, not identify. Because we don't, in low and middle income countries, we do not have the personnel to go and screen everybody and identify high-risk people. So it is all universal strategies.
Wonderful, Dr. Lakshmi Vijayakumar. That's at least on a uplifting note. Thank you for sharing something that's available online. So I'm going to close the session by a quick thank you to all our wonderful panelists. Akshaya, thank you so much for sharing your thoughts and your reflections. Really nice of you to join us and give your insights. We have Ms. Neelakantan, who's been able to speak as a parent and as an educationist to, make us understand what are the problems in today's world. And, it's not just so simple. There are many players in it. And Arjun, thank you so much for, presenting. I mean, I think it's important for us to understand that collecting data itself is a huge challenge. While, we have articles which are published, media seems to play a big role. We're all talking about what happened yesterday in Telangana. And hopefully, I mean, these are all very important information for us. Thank you, Arjun, for sharing your insights. And of course, we have Aishwarya and Sharon. Thank you so much for presenting your study. It's really helpful for us to understand. I would also like to thank the other team members, or I hope they've joined today. Karthik, who helped us with all our data. And then we've also had Akshita, who's who was part of writing the report. Before that, we had Namrata Rao and Mrinalini Ranganathan, who put this together. And of course, Dr. Nachiket Moore for helping us to, conceptualize the whole thing. Thank you so much. And Krea for partnering us. Of course, I would like to thank SFL, BALM for, making this happen. And of course, this was part of the Center for Trauma Studies and Innovation. So Dr. Lakshmi Ravikant, who is our dean, who for reviewing the documents and sort of, reviewing, the different drafts. Vijaya Nagraj, thank you for being with us. And of course, Dr. Kishore, thank you so much. I know you're coming out of an outpatient service and you're in the car. Thanks for sharing your insights and closing the session. And I would also like to thank our participants. Very important. We had almost 150 registrations, and we hope, there are some takeaways and we can all sort of come together. And what I really like is that, we're just not talking about children, we're talking about also adults who are big players. I think that's a critical learning from this. So I guess with this, we're done. And Ramesh, thanks for moderating. It was really helpful. I know there are lots of questions coming in and we didn't have time, but it was really wonderful that, we heard different voices. And Vijaya, as part of Visesh, thank you so much for sign language. We're really grateful for you being there with us. So, of course, I should not forget Diksha and Kirtana of Krea, who have been helpful with communications. So this is a small dissemination that we attempted to on a topic which is right now really hot as Chennai summer. And we're going to see a lot of this because we do know that, all the results are coming out, board exam time. And of course, Sneha, who's doing wonderful work, a very interesting model, not an easy task, but who's been there standing and relevant today. Thank you so much, all of you.